Now I'm going to go through a few reports, which one from McKinsey, one from Microsoft, and one from the European Union, and what their and give their implications in the area of health informatics. So these McKinsey has two reports. One is the summary of the other, and they're remarkable for having a very complicated long URL, which I give here. This came out April 2013, so it's a relatively recent for the purpose of this lecture report. And it had several important conclusions, which we'll now go through. So these are sort of list of the various changes that are making big data and health informatics critically important. There is the actual demand for better data, which is coming due to the cost pressure and the fact that people who use better data are getting better results. And so the people not using big data are worried. There is a lot of more, there is the supply issue. There is a lot more relevant data. EMRs, as electronic medical records, are becoming more pervasive, and that allows data to be shared and used much more easily. And also, you can link that to not just health data, but social networking and other types of data on people. And then we have here the technology. And the technology is allowing you to we're doing X informatics in the clouds. We can run our data analytics. We can use Hadoop. We can process all this stuff. And we're not worried about the large amounts of data. And then we have the government actually producing market change through various new laws and new initiatives. And certainly the government is pressing the key interoperable standards which are allowing data to be exchanged. There's no point in gathering a lot of big data unless there's some agreement on format so it can be exchanged. So this is a summary of the types of data. We have here activity claims. I mean, this is insurance data. And here we have the clinical data, the actual data from the hospitals and the doctors, the electronic medical records and all those images. We have pharmaceutical companies which have huge amounts of R&D data, screening data to showing you what a particular chemical does on what particular biology sample. And then we have patient data. Patients will be tweeting about hospitals and telling you about which hospital is good and what's not good. And also they'll have their own social networking data telling you about their lifestyle. So here we have these four major big data pools, which have all exploded over the last few years. Some of these data have actually existed before, but often not in electronic fashion and certainly not accessible broadly. We'll never have, at least in the near term, health data accessed very freely because of privacy issues. I showed you some examples with quantified self where there were no privacy issues, but most data is restricted for privacy issues. But still, doctors and researchers will have access to significantly more data than they used to make better decisions. So these are the so-called value pathways, what this data is actually going to enable. It enables you to live better. I live terribly, so I can certainly be inform my lifestyle that will promote my well-being. Then if I get ill, which hopefully we won't, we can actually go look at the data on the various hospitals and who does what and which approach is effective to actually get the right care. And then given that care, we can, let's say, find out which provider is the optimal provider. So we need better care. We can find the right approach. We find the right place to do it. And then we can also look and see whether it really is necessary to buy that special a proprietary drug or whether a generic is actually going to be sufficient. And that should be documentable through data where people compare the response to the different types of available drugs. And then finally, this is all being advanced by the big data revolution. The pharmaceuticals and the government are all driving more and more innovation in this area because this is the area where there's the greatest chance of improving, even for the government, the well-being of the citizens, and for the pharmaceuticals to produce better products, which will not only help citizens but also help the pharmaceuticals. So here, this slide here suggests that several $100 billion can be saved by taking what's effectively known now and applying it. And these are in these pathways, the right living pathways, 70 to 100 million billion dollars. Did I say million? 70 to 100 billion dollars can be saved by targeting disease prevention and doing programs that are enabled by data. Then we have identifying the right care, so we can actually document which approaches are the effective approaches. We needn't spend more money on things that are not actually necessary, and we can actually get that all coordinated across all providers. Then we can go to the right provider. We do not have to always go to emergency rooms, and we don't necessarily have to go to the most expensive primary hospitals. We can customize the provider. Then we have the right value, where we again can get the cost-effective drugs and not pay too much. There's a lot of expenses in the medical profession at the moment by people being very conservative. That conservatism can possibly be relaxed if we have a more data-driven approach suggesting that a certain step is or is not necessary. And here's where we have, possibly for a researcher like me, the most interesting area: accelerating discovery in the area of drugs and medical treatments through research and development and studying existing big data. Anyway, that total, you can see all of these areas has similar gains from 50 to 100 billion dollars, and the total is 300 to 450 billion. So here we have again these 5 pathways, the different ways we can use big data: the right living, the right care, the right provider, the right value, and the right innovation, and how it's spread among the different stakeholders. We have the poor old patient, the medical institutions, the insurance companies, and the pharmaceuticals. And this sort of shows you where the innovations are spread. And they're along almost every area. Possibly you can see that getting and choosing the appropriate value has a lot of that, and the choosing the appropriate care. So these are sort of related, because this tells you the care, this tells you how it should be implemented technically, which is the right drug and the cost-effective drug. So these have the greatest gains, but there's a lot of gains from people living in a healthy fashion, significant gains from choosing the right hospitals, and actually slightly disappointing. These are not dollar numbers, these are number of examples which they've identified. There are somewhat fewer in the innovation area. These tell you how these particular innovations, how they're divided. So there is, like here we have, most prevalent is actually being proactive about managing health and health education, just telling the patients what's going on. There's somewhat less about actually using the right drugs. Here we have choosing the right approach to either making people healthy, live healthier, or curing their diseases. And again, communicating with the physician. Personal activities are actually the most promising. Here we have the right provider. Well, the dominant here is actually doing a financial optimizing dollars and location. And there is a significant amount just from looking at the quality of the performance of particular institutions. Here we have doing the right value, and there's a small amount of fraud detection, but most of it is enabling people to make informed decisions. And here we have innovation, and we can use big data to actually improve the process for getting new drugs approved. So this tells you how these 5 pathways, how they break up between public data types and proprietary data types, and what's called acquired data types, which are ones that you can effectively buy from somebody else, which are online resources which are not public, but they are available. And these are the types. Here we have these dark blue things are the venture capital funded businesses, and here we have the actual participants in the health data initiative, which are obviously possibly the largest source. Although when you get to proprietary, then not surprisingly, the actual businesses start being the dominant user of that particular type of information. So this tells you what you're meant to do if you're an organization doing a big data transformation. And this is not specially for the this wasn't specially for this report, but there's a broad idea, and it tells you how you actually implement the big data transformation. You need to know where you want to go. You need to decide what you have to do to get there. You have to design getting there. You have to travel to where you want to go, and you have to keep on going and not fall back, because one of the problems in this world we live in today is everything's changing. And so it's very important that we not just do something and then sit back, because there is new discoveries and new data every day. So this tells you the little more detail on where the big data and the analytics come along. So we have the reporting. These are existing data, such as personal health records and information that's already been reported about the effectiveness of drugs. Here we have monitoring. These are all these devices strapped to you, telling you how you're doing. Then we have sort of 2 types of data mining, one called evaluation and one called data mining. And this is looking at the basic correlations, and this is a more thoughtful analysis to actually decide what the right answer is. So I'm not certain that everybody would do this particular division, because you always have, remember rightly, we do the data, information, knowledge, wisdom, decision pipeline. So this is just going through that pipeline. And we always have that in every case. And then we need to know what will happen. And given what we happen, we have to adjust our insurance rates and make certain our hospitals are prepared. So big data will affect all sorts of things.